Hi, this is Shelley Kraft coming to you live on SNNLive. We're at the Israel Conference 2013 here in Bel Air, California. I have with me Dr. Oren Fuerst of LabStyle Innovation, symbol DRIO. It's a publicly traded company. Dr. Fuerst, Oren, welcome to SNNLive.
Thank you for having me here, Shirley.
It's good to have you. You've been on before. I want to go and get an update on the company, but first, for those that may not know you, let's give them an overview of the company.
Okay, certainly, thank you. LabStyle Innovation is creating an ultimate platform, end-to-end solution for diabetes management as well as other chronic diseases, which is based on a combination of medical devices connected to smartphones via the audio jack, and coupled with an application and cloud-based services, all in all creating the first truly fully integrated solution for diabetes management, which is going to change completely the landscape when it comes to telemedicine services.
How far along have you come since I last interviewed you in January?
So a lot of progress since January. What we're doing, actually we finalized the product. We are expecting the regulatory clearance in Europe in the next few weeks. We plan to start launching the product in Europe. We announced already a distribution deal in the UK that would give us access to more than 90% of the family physicians throughout the UK. We have a variety of other deals in the pipeline, and we plan to launch the product utilizing our existing infrastructure with manufacturing capabilities here in the States. And a lot of exciting things are in the pipeline for us.
Now, ladies and gentlemen, diabetes is a runaway disease in the United States. And by the way, diabetes leads to so many more illnesses. Everything from compliance to taking the medicine to being able to determine what your sugar is at what time. I just want to share with you that my concern, being a U.S. citizen having diabetes, is when will this be available in the United States?
So I cannot commit to a specific time. We anticipate that to be probably early next year, but that would be pending regulatory approvals, obviously. In the meantime, other jurisdictions will benefit from DRIO, so you can benefit from the experience of others in other countries. We are preparing ourselves for a very significant marketing launch here in the States. The user experience is phenomenal thus far, user feedback is phenomenal, and we anticipate DRIO to be a great success.
Okay. You know, I got questions. So, now you take your blood, use like one of those little machines, and then the strip comes out, you test your blood, and it determines what your blood sugar is, and that's it. You know, there's no electronic connection, there's no personalized medicine, there's literally no record keeping unless you take the time to write it down in a book, and you don't do anything about it unless it's too high, too low, but you don't remember 4 days ago what it was, so you don't know how you're trending. Isn't that what you're changing the landscape of? Tell us how.
We're changing the landscape on multiple domains. I mean, the first one is really the footprint of the device, meaning that rather than schlepping around with the kit, diagnostic kit, what you have is a Zippo-like or a Zippo-size device that has all that you need. That's essentially the kit, which has the built-in licensing device, strip dispenser, and a plug that connects your audio to the audio jack of your smartphone. But that's only the beginning. After the convenience factor is so much greater when it comes to the testing itself, but that's only stage one. Once we capture the data, then that's really where the magic starts. Because we capture information about your life. We capture information if you're an insulin-dependent patient, we ask you for your food intake in order to give you insulin recommendations. We give alerts and reminders, so just think about the teenager or a kid in school with type 1 diabetic who needs to test himself 10 times a day. And they never do that. Now, until now, the parent was quite concerned. The parents are typically quite concerned. They call the school nurses, they call the teacher, they try to call the kid. And here there will be like constant reminders to the kid as well as to the parent in terms of the time, whether he tested himself, he didn't test himself. Also, once he puts the food intake and adjusts the insulin amount in his body, the following results, we see whether the insulin was properly digested by the body, or whether the next reading was, off the chart. And then you have a variety of communications with your school teacher, with your nurse, with your clinician, with the parent. So it's a new realm of a treatment.
And it's stored.
And it's stored on the cloud. It's replicated. Everything that is stored on your device, on your smartphone device, is replicated to our servers in a very secured and confidential fashion, adhering to a variety of regulations related to medical information. And with permission, with the proper permissions, it's accessible to a variety of caregivers, be that your parents, be that your doctor, be that diabetes nurse, and others.
Nutritionist. Ladies and gentlemen, this is what is quintessentially known as disruptive technology. Changes the landscape. I'm not finished, but I want to give people your website right now so that they could go there while they're watching this.
Yes, so the product is DRIO. The website is mydario.com, mydario.com.
And I just want you to go to the website, get updated information, see the progress that the company's making. Look, it's a publicly traded company, and of course, there's a lot of reasons why you want to learn about the company. But in the world of diabetes, this is a very, very important company, whether you listen to me or not. Now, where are you going in the future?
We plan to become a dominant player in this segment. And we're looking at an industry that has revenue north of $10 billion a year, and we definitely plan to become one of the major players in this industry. That's in the diabetes space alone. Beyond that, we plan to expand the platform to additional body fluids testing using our intellectual property and our great technology development team.
Ladies and gentlemen, the name of the company is LabStyle Innovations. The symbol is DRIO. This is Dr. Oren Fuerst. And by the way, what's your background?
I have a PhD in accounting and finance from Columbia Business School. I was a faculty member at Columbia Business School and Yale School of Management. And I'm an entrepreneur in the medtech space for the past decade. And surrounding myself with a great team of competent technologists from the software, the hardware, the biology, regulatory affairs, legal, and other experts.
And now market awareness. We are at the Israel Conference 2013 in Bel Air, California. Dr. Oren Fuerst, LabStyle Innovations, DRIO is the publicly traded symbol. I just wish you more luck than you could imagine.
Thank you so much.
You're welcome.